Naltrexone Hcl is a medication used to prevent people who have been addicted to certain drugs, opiates, from taking them again. It is part of a complete treatment program for drug abuse, including compliance monitoring, counseling, behavioral contract, and lifestyle changes. This medication should not be used in people currently taking opiates, including methadone, as it can cause sudden withdrawal symptoms. Naltrexone works in the brain to prevent opiate effects, such as feelings of well-being and pain relief, and decreases the desire to take opiates. It is important to ask your doctor or pharmacist if you should have naloxone available to treat opioid overdose and to teach your family or household members about the signs of an opioid overdose and how to treat it. In addition to treating drug abuse, Naltrexone Hcl is also used to treat alcohol abuse. It can help people drink less alcohol or stop drinking altogether, and it decreases the desire to drink alcohol when used with a treatment program that includes counseling, support, and lifestyle changes. As for the daily dosage and optimal timing, it is important to follow your doctor's instructions. Typically, Naltrexone Hcl is taken once daily, either with or without food. It is best to take it at the same time each day. Remember to not take this medication if you are currently taking opiates, and to talk to your doctor about naloxone availability and alcohol abuse treatment options. When taking Naltrexone Hcl, you can take it with or without food as directed by your doctor. It is usually taken once daily, but if you are part of a supervised program, it may be taken every 2 to 3 days to make scheduling clinic visits easier. Naltrexone can be taken with food or antacids if it upsets your stomach. Before starting naltrexone, a urine test should be done to check for recent opiate drug use. Your doctor may also give you another medication, called a naloxone challenge test, to check for opiate use. You should not use any opiates for at least 7 days before starting naltrexone. Certain opiate drugs, like methadone, need to be stopped 10 to 14 days before starting naltrexone. The dosage of naltrexone is based on your medical condition and how you respond to treatment. Your doctor may start you at a lower dose and monitor you for any side effects or withdrawal symptoms before increasing your dose. It's important to take this medication as directed by your doctor. Do not increase your dose, take it more often, or stop taking it without your doctor's approval. To get the most benefit from naltrexone, take it at the same time each day. If you start using drugs, opiates, or alcohol again, make sure to tell your doctor. Some common side effects of taking Naltrexone Hcl include nausea, headache, dizziness, anxiety, tiredness, and trouble sleeping. In some cases, mild opiate withdrawal symptoms such as abdominal cramps, restlessness, bone/joint pain, muscle aches, and runny nose may occur. If you experience any of these side effects, it's important to let your doctor or pharmacist know. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the risks of potential side effects. Many people who use Naltrexone Hcl do not experience serious side effects. It's possible for opiate withdrawal symptoms to occur shortly after taking naltrexone. If you experience symptoms such as abdominal cramps, nausea/vomiting, diarrhea, joint/bone/muscle aches, mental/mood changes, or runny nose, it's important to contact your doctor immediately. In rare cases, Naltrexone Hcl has been associated with serious liver disease. The risk of this is increased with larger doses. Be sure to discuss the potential risks and benefits with your doctor, and contact them right away if you notice any symptoms of liver disease, such as nausea/vomiting, severe stomach/abdominal pain, dark urine, or yellowing of the eyes/skin. Although rare, a serious allergic reaction to Naltrexone Hcl is possible. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. Remember that this is not a complete list of possible side effects. If you notice any other effects not listed here, it's important to contact your doctor or pharmacist for further guidance. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting Naltrexone Hcl, make sure to inform your doctor or pharmacist if you have any allergies or if you are allergic to any inactive ingredients in the product. It's important to talk to your pharmacist for more details. Also, before using this medication, let your doctor or pharmacist know about your medical history, especially if you have used any type of opioid drug in the last 7 to 14 days, or if you have kidney or liver disease. If you are taking naltrexone, it's important to carry or wear medical identification stating that you are taking this drug, so that appropriate treatment can be given in a medical emergency. This medication can make you feel dizzy, and alcohol or marijuana can increase this effect. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. You should also avoid alcoholic beverages, and talk to your doctor if you are using marijuana. After stopping naltrexone treatment, you may be more sensitive to lower doses of opioids, which can increase your risk of possibly life-threatening side effects from the opioids. Naltrexone Hcl blocks the effects of opiate drugs and similar drugs, but large doses of heroin or opioids can overcome this block, which can be very dangerous and may cause serious injury, loss of consciousness, and even death. It's important to completely understand and accept the risks and benefits of using this medication, and to follow your doctor's instructions closely. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Additionally, this drug passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with naltrexone Hcl, as they may affect how your medications work or increase the risk of serious side effects. Always keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's important to not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with naltrexone Hcl include dextromethorphan, diarrhea medication, such as diphenoxylate, disulfiram, opioid pain or cough relievers, such as codeine, hydrocodone, thioridazine. Additionally, naltrexone Hcl may interfere with certain lab tests, such as drug tests, which could potentially lead to false test results. It's crucial to inform lab personnel and all your doctors that you are using this medication. If you or someone else has taken too much naltrexone Hcl and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can reach out to a provincial poison control center for assistance. It's important not to share your naltrexone Hcl medication with others. Your doctor may also want to monitor your liver function and other medical tests while you are taking this medication, so be sure to keep all of your medical and lab appointments. If you have any questions or concerns about this, consult your doctor for more details. If you forget to take a dose of naltrexone Hcl, take it as soon as you remember. If it's close to the time of your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. It's important to store naltrexone Hcl at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When it's expired or you no longer need it, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to do this. Remember, don't flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.